Hello, nurses. My name is Rebecca. I'm a registered nurse and welcome to Villa Health Hospital. Today, I will be speaking to you about nursing sensitive quality indicators, and I'll be looking down at my computer to give you accurate information based on the peer reviewed articles that I researched for this presentation. The National Database of Nursing Quality Indicators, also known as NDNQI, is an entity of the American Nursing Association. Their framework is based on the Denobian model, which measures quality in structure, process, and outcomes. The NDNQI analyzes nursing services and quality enhancement using a scorecard system. Also, the American Nursing Credentialing Center's magnet recognition program requires disclosing nursing sensitive indicators to maintain magnet status. The criteria for alterations in health that nursing practice can directly impact are known as nursing sensitive indicators. The NDNQI enables the evaluation of nursing at the unit level by providing regular reporting on structural, procedural, and outcome factors. We will discuss patient falls because it is a significant problem, safety problem that is preventable. A fall can lead to a fracture or internal bleeding, leaving the patient in a worse state than when admitted, and these complications can leave permanent damage. When given patient care, we, the nurses, the staff, we must be aware of the risks, and put measures in place to prevent falls. The hospital keeps track of falls by reviewing incident reports. Therefore, it is essential to file a report when a fall occurs. It is crucial to document the specifics precisely so that when it's reviewed, any patterns can be identified and meaningful interventions for prevention can be initiated. It is also a critical criterion in developing evidence-based practice protocols for the future. The hospital facilitates documentation with software like the electronic health record. Accurate documentation is helpful for research purposes and in the present to facilitate to the next nurse to give patient-centered care. The EHR allows nurses to view the patient's history, including but not limited to their surgeries, diagnoses, history of falls, medication, and potential side effects of those medications like sedation or weakness. Having the EHR is helpful because the data will help nurses prepare adequately to prevent falls. Even when getting shift report, it is necessary to ask relevant questions and look at the patient's medical history to identify anything that can be a potential risk for falls. For example, if a patient has a diagnosis of Parkinson's, we can draw the conclusion that they are a risk for falls because they have altered gait. The Nursing Leadership Journal presented a study that used the NDNQI Falls Injury Indicator. The unit provided staff and patient education on falls. The nurses flagged the patients with a high risk of falling and conducted regular monitoring and rounding on the patients for 1,000 days. The result was very positive. It resulted in a decrease in fall rate from 3.07 to 2.2, accompanied by a decrease in injuries from 0.77 to 0.65. These promising results display the importance of the interprofessional team's role in preventing patient falls. Each of us hold a vital role that, if practiced, can spare a patient from pain and suffering. As nurses, we must enforce universal precautions and encourage all to do so. The universal fall precautions begin on admission while we are orienting the patient to the floor and showing them properly how to use the call bell. It requires the staff, but especially us nurses, to create an accessible, uncluttered environment for the patient, ensuring all their needs will be in reach and that the bed is locked and secured in the lowest position possible. Our role is to encourage each other and the techs who help us to foster a safe environment with collaboration. If a nurse misses something, the other can assist. On the floor, there are plenty of times when a nurse is multitasking and forgets to put on the yellow falls risk bracelet or the non-skid socks. And in our outstanding team, someone always notices and provides them for the patient. As nurses, we must foster a collaborative environment in this field Teamwork is the only way to do our best work and give patients the best care. MedSurg Nursing Journal replicated the falls tip study, which reduced 3.3% of falls for the 85% of the nurses who adhered to the suggestions. They customized fall prevention to each patient and their individual needs. A laminated poster was placed where the patient and the family could see it. The poster contained colorful images that checked off patient risk and customized interventions for them. No patient is the same, and neither are their needs. And our care should be adapted to each patient individually. We need to ensure we are not using a cookie cutter approach when giving patient care and ensure that we're giving patient centered care. The patients and their families should be educated and included in the falls prevention process. Increased awareness contributed to the decline in falls. It is important to remember that the family is an extra set of eyes for us, and we can enforce teaching through them to prevent falls. We must ensure that we educate our patients and their family for the patient safety. The hospital primary form of disseminating aggregate data is through mass emailing, aside from directing all management to discuss it in unit meetings and daily huddles. It is essential for all nurses to check their email for these updates regularly and to be present at the meetings and huddles. The organization also creates electronic information classes stating the problem and educating the staff on solutions to integrate to care. It is required for all to complete these trainings in a timely fashion and put into practice the suggestions that are given. The updates and recommended interventions are not optional. We need to put them into our practice to give our patients the safest care possible. It is possible to reduce and eliminate patient falls following the nursing sensitive quality indicators. We will use hospital software and training to assist in our patient care. We will pay attention in meetings and put into practice the recommendations given. We will educate our patients and their family while fostering a collaborative and safe environment for each patient. And together, we will give safe patient care and reduce the risk for falls. Thank you for coming to my Rebecca presentation. I hope you put all this into practice, and I will see you on the floor. Okay, 8 minutes, yay.